Good afternoon, ladies and gentlemen. Once again, welcome to this media updates on coronavirus. Now, this briefing has been organized by the chair of the National Emergency Response Committee on Corona, who is also the Cabinet Secretary, Ministry of Health, Honorable Mutahi Kagwe. This afternoon, he's joined by the Director General, Nairobi Metropolitan Services, Major General Badi, who is here with us. Is also the Governor of Isiolo, Mheshimiwa Mohamed Kuti, who is representing the Council of Governors and all the governors to demonstrate the nature of this operation that brings the whole of government, both national and county government, into this campaign. You also have the Director General, Health Services, and other senior officers. True to our word, ladies and gentlemen, we did mention that we are going to give you updates every single day. And today is another day. And therefore, once the Cabinet Secretary is done with the briefing, you'll get an opportunity to ask questions. And please, as you get the opportunity, mention your name and the media house that you represent, and also keep the questions to the scope of today's briefing. And also don't forget to only ask one question so that as many journalists can get the opportunity to ask questions. With those few remarks, I now wish to invite the chair to make the briefing. Fazili, please.
Members of the press, fellow Kenyans, yesterday we announced that there were no new coronavirus cases and that the 7 patients who have tested positive for the virus are still undergoing treatment and are stable. We continue to monitor their progress as well as individuals that have come in contact with them. Following successful contact tracing, we are now monitoring an additional 7 people. We have released a total of 44 contacts following expiry of the 14-day period that they are supposed to be isolated. 4 more suspected cases have been admitted at Bagathi Isolation Unit since the last update. And 1 case tested negative and is being processed for discharge. The remaining 3 are waiting laboratory results. We are also following a case in Kilifi County whose tests are also running, and the test will be cleared by tomorrow 7 a.m. Our actions continue to be guided by the trends that we have observed in other countries. Evidence from other countries indicate that the number of infected persons increases dramatically in the 2nd week following confirmation of first case. Consequently, the next 2 weeks are extremely critical for this country as we seek to contain the outbreak. We remain focused, emphasizing high levels of hygiene and maintenance of social distances as the most effective containment measures. These measures require the concerted and committed effort of all of us. Every person must play their part in reducing the risk of transmission through our whole government and our whole society approach. If there is a moment in our country's history where we need to embrace the Harambee spirit, it is today. It is now. Our actions this coming week in particular will determine whether we shall go into a full-blown crisis with grave human economic consequences, or whether we shall limit the adverse impacts of this disease, save lives, and reduce the impact to our economy. Balancing the imperative to contain the impact of this disease and the desire to ensure continuity of socio-economic activities without implementing extreme actions, the National Emergency Response Committee, at its meeting today, the 20th of March 2020, has resolved and directed the taking of the following additional precautionary measures. A. All entertainment areas, bars, and other social spaces are to close their doors to the public by 7:30 every day until further notice. Effective Monday, the 23rd of March 2020. During operational hours, all such facilities are to define the maximum number of persons within their premises at any given time, so as to conform to the social distance of 1.5 meters apart. The above facilities are encouraged to introduce, where possible, home delivery services and other innovative mechanisms to support this initiative. I would like to state that eataries, places of food, not bars, places of food, can continue provided that they keep the distances that we have spoken to. But all bars and nightclubs are to close at 7:30 every evening. B. All supermarkets are required to limit the number of shoppers inside the premises at any given time in a manner that conforms to the social distances requirement of 1.5 meters apart. All supermarkets and shopping areas are directed to determine the number of shoppers inside based on the size of their premises. Our queue management system must be established to manage the crowds outside the supermarket, with preference given to the elderly, expectant mothers, and people living with disabilities. Similarly, supermarkets and other shopping areas and no other established of a similar nature are to encourage home delivery services while maintaining high standards of hygiene. All supermarkets and shopping areas must also disinfect their facilities several times a day. This requirement extends to malls and other such like shopping facilities. Where feasible, we encourage supermarkets to open on a 24-hour basis, and upon request, the government will facilitate the provision of the necessary security personnel. This is to ensure that even as you distance, there will be sufficient time to go. Now, while going to those supermarkets, let me again reiterate, it is a person at a time. A person at a time. We do not expect people to go to supermarkets or other social areas bunched together with their children, with their families. Those must be left at home. Shopping should be restricted to one person. Open-air markets, including vegetable, mitumba, and bazaars, are high-risk transmission environments. The management of local markets are directed to ensure that the premises are disinfected regularly to maintain high standards of hygiene. Vegetable markets, in particular, are required to ensure that their goods are displayed on raised platforms and waste and other garbage is collected daily. And I would like at this point to thank those in the chairmen of certain supermarkets, certain markets, open-air markets, who have committed to this cause. And some of them have actually been calling me and telling me that this is what they are going to do. They are doing so at their own cost, and the commitment is highly admirable. Tomorrow, we will embark as a ministry on a major cleanup of fumigation, starting with the Gikomba market tomorrow. As soon as the markets open, there will be nobody there tomorrow because of the prayers, and therefore we will go there in their absence and fumigate everything. D, the county governments, and Dr. Kuti will add to that, are required to prioritize garbage collection and cleanliness of all markets, as well as ensure provision of soap and clean water in all market centers. As far as possible, social distance requirements should be observed. For the avoidance of doubt, markets are to remain open until further advised, provided the directives that we have given are going to be followed, because people have to get places to buy food in any event. E, corporations and businesses have already been encouraged to allow, where possible, employees to work from home. Where employees are in an office, the employer should ensure that social distance requirements are adhered to. Employees may be encouraged to proceed on leave at this time, and employers should actually encourage their employees, those who can, to proceed on leave. We have noted that some companies have yet to comply with this advisory. Indeed, I am told some organizations in the financial sector have specifically asked their employees to continue as usual. They would be held in very bad light in future if anything were to happen in those premises. Your support, as I have indicated earlier, will have significant impact on the trajectory and impact of this disease. To ensure business continuity, that is F, for our manufacturers and industries, factories are required to operate using a minimum workforce, but on a 24-hour shift rotation system, so as to assure compliance with social distancing requirements. This will also help with logistics of public transport of workers, because there will be fewer going to work at any time. Where additional security is required, the government is able to provide the same. To reduce the risk of transmission in our public transport system, we encourage as much as possible that persons stay at home unless on essential business. Public service vehicle operators have already been asked to observe high levels of hygiene during this period. In order to maintain social distance requirements in public service, it is directed as follows: that 14-seater matatus will carry a maximum of 8 passengers. 25-seater vehicles, a maximum of 15 passengers. 30-seater vehicles, and above to maintain a 60% maximum of seating capacity. This similarly applies for SGR and commuter train services. And when this happens, it is expected that people will adhere to the directions of the public service transport operators. In other words, there is no point of having 8 people and then 2 people are sitting very close together and leaving the other seats open. The idea is to stay as far away as possible from each other. Public service operators must further clean and disinfect their vehicles at the end of each trip and provide sanitizers for passengers. We welcome the decision by the Kenya Revenue Authority to release seized ethanol for the manufacture of sanitizers that are to be distributed free of charge to the public once production begins. In furtherance of His Excellency, the President, all hospital management in public and private hospitals are to restrict patient visitations to family and relatives of patients who have been expressly contacted by the hospital. Such persons will be allowed access for purposes of facilitating specific requests pertaining to patient care, among them being blood organ donation, payment of bills, discharge of patients, and such necessary activities. We reiterate once again that all travelers coming into the country, now obviously restricted to Kenyans and foreigners with valid resident permits, must self-quarantine for a period of 14 days, failure to which they risk arrest and prosecution under the Public Health Act Cap 242. We wish to specifically reiterate that self-quarantine requirement applies to everybody, including diplomats, international organization staff, and each and every person. And I have said that it would be best if this were observed. As we speak, there is a gentleman we have just picked up in Kilifi because of refusing to self-quarantine, and this is going to continue. And there is no reason for anybody to be embarrassed by being picked up because of refusing to protect themselves and to protect other Kenyans. Remember, when you refuse to self-quarantine, you are exposing the rest of society to the potential of them getting the disease. So when we ask people to self-quarantine, we do so in good faith, but we also do so knowing very well what the impact of contacts with infected persons is. It is irresponsible of anybody required to do so, to be walking the streets, going to discos, shopping centers, when you know very well that you can infect other Kenyans. Please, I beg responsibility in this area. As previously communicated, measures on hand washing and hygiene standards are the most effective way to manage the spread of this virus. Finally, ladies and gentlemen, I once again thank all those who have already made individual and collective efforts to sensitize and manage our overall responses to the outbreak. And I want to particularly again reiterate my thanks to the Fourth Estate. These measures may be inconvenient at the moment, and we have no doubt They will inconvenience a lot of people. But I assure you that they are necessary for meeting our indicated objectives of keeping all Kenyans safe. We call for self-discipline and active goodwill in this endeavor. I want to thank you, and before I take on any questions, ask Governor Kuti to just mention about, reiterate the issue of hygiene in counties. Governor Kuti.
Thank you. Good afternoon. I think, number one, I want to start by thanking all Kenyans, because already I am seeing, like in Nairobi, congestions are slowly reducing. But I would like to urge what Waziri has said, that the coming week and the next week are the most critical weeks according to our observation of what is happening to the countries that have been hit by this disease before us. So it is very important not to panic, but also it is very crucial that we become now more vigilant. So number one, the issue of markets, the issue of disinfecting markets. I would like all counties to take this matter very seriously. At the entrance, there should be hand washing and sanitizing where possible, and general cleanness of the markets and the towns in general. The issue is here. Now we are asking Kenyans actually to stay home. That the message is, please stay home as much as possible. Schools have closed, not because of holidays. It's because the kids have to be kept at home. Let them not be gathering in the fields. And the last message is, even as we are seated here, we are not keeping the social distance. We should maintain social distance at every place we go. Thank you very much.
I think, no, are you going to move in or you want umbrellas or what?
Sorry?
Umbrellas, are there any umbrellas around?